New at 5:30 as we wrap up Mental Health Awareness Month, we're checking in with a local sheriff's office doing what it can to take care of inmates. More than half of the Virginia Beach Correctional Center's population suffers from a mental disorder.
Yeah, 1 year after appointing its first mental health liaison, Sarah Hammond sat down with a sergeant and an inmate to talk about how the push toward more mental health care has made a big difference.
Nathaniel Turner
hello.
wanted to be taken seriously.
They always just, oh, you're a crazy guy, crazy and stuff.
He says his head can get crowded.
I've been getting into trouble on the streets, like self-medicating because I hear voices and stuff like that.
In the Virginia Beach Correctional Center since February, Turner now has Sergeant Brandon Mullen on his side.
What's up, man?
Mullen is the Virginia Beach Sheriff's Office first mental health liaison, acting as a go-between with the courts, city services, and the jail. It's a position he advocated for and got last year.
This, like, I say, like the first jail I went to where they actually take mental health seriously.
That's because Mullen takes his own mental health seriously.
I have my own personal struggles with mental health. I think a lot of people do. I've been diagnosed with bipolar 2, PTSD, general anxiety.
Almost 5 years ago, the Sheriff's Office began a comprehensive program partnering with the Virginia Beach Department of Human Services. With $3 million of federal funding, nurses started screening all inmates for mental illness within 48 hours of booking.
Diagnose you correctly, put you on medicine, and try to treat or help cope with the problems.
As they get closer to getting out, Mullen and his team work to set the inmates up for success. According to a report from former Sheriff Ken Stolley last year, 63% of the jail population suffered from at least one mental disorder. They discharged almost 400 inmates from the program, and he called the results, quote, promising. 94% were released with housing in place. 100% had an adequate supply of medications and were linked to benefits like Medicaid and Social Security. But Mullen says there's no magic wand to make sure those same inmates don't come back.
I think there's a huge misconception where they think people are going to get services and the person's like, oh, I figured this out. Like, it's not so much that. Sometimes it's, they come back right after they get out, and then we won't see them for 3 or 4 months. And then after that, we won't see them for another 5 or 6 months.
However, in that same fiscal year 2023 report, 98% of the mentally ill offenders did not return to jail after re-entering the community. That's compared with a nearly 100% recidivism rate for that same population in the past.
Most people who come to jail go back into the community. So we take that serious.
Mullen, who is currently studying clinical counseling at Old Dominion University, calls mental health the future of law enforcement.
People are people. I want to live in a community that treats everybody with love and respect.
Turner says he wants to get better and start fresh, not only for himself, but also for his young son.
To make sure he don't have to go through what I go through, I'm really taking this mental health thing real serious now.
In Virginia Beach, Sarah Hammond, 13 News Now.
And Virginia Beach not the only city screening their inmates and working on their mental health. In 2017, jails across Virginia were required to begin completing mental health screenings when inmates are booked. Though former Sheriff Ken Stolley calls Virginia Beach's comprehensive program a blueprint for other facilities.